camera.
If you're not quite camera ready, just to give you an FYI, but I just want to again welcome everybody and thank you so much for joining us this afternoon. And Shanae, I'll turn it back over to you.
Okay, actually, I'm going to go ahead and turn it over to Miss Nina Ward, who will review our agenda for today.
Hi, everyone. Thank you, Shanae. Thank you, Margaret. Okay, so for today, we will start with reviewing a lot of the content and discussion from our last call, reviewing the behavioral health problem statement, root causes, and selected starting point. So taking all of the input from our last few calls of Healthy Minds monthly meetings, and then moving it forward into goal setting and a divergent thinking activity. So taking discussions from prior calls and moving them forward, putting them into action. And then we'll end in our typical fashion, community announcements and upcoming meeting before we adjourn on this lovely Wednesday.
Awesome. Yes, I'll try to get you all out of here. I know we're scheduled till 4:15, but if we can knock it out early, we will do that. The weather is a little gloomy, but it's not bad out there. So we'll try to get everyone out and get some steps in for our Heart Health Month. So thank you all again for being here with us. As Nina mentioned, I'm just going to try to just ground today's conversation, our goal setting conversation, and just quickly review the selected behavioral health problem statement, the root causes that we identified, and the CHIP action plan starting point that you all voted on during last month's meeting. And I think this will be especially helpful. I'm seeing a lot of new faces, some names that haven't been here for a while. So I think this will be great for those who are joining us today who may have missed a month or two, or who may be new to this information, because it's really going to help us ensure that we're building from shared understanding as we draft our behavioral health goal today. And if one of the co-chairs doesn't mind helping admit people in, so I'm not just bouncing all over the place, I would really appreciate that. Thank you. All right. So, for those who already know, the problem statement that was selected by our CHIP steering committee back in, I think, September, really just highlights that the rising rates of depression, anxiety, and substance use, especially are rising, especially among youth and young adults in our county. And the data from the community health assessment shows that nearly half of the residents are reporting poor mental health days, which really just reinforces the need for prevention, for early intervention, and expanded access to services. Now, back in November, we used the 5 Whys approach to dig deeper into what was driving these trends, right? So instead of just stopping at symptoms and talking surface level, we tried to push forward a bit into some of those systemic drivers, including things like crisis-driven systems, underinvestment in prevention. We talked a little bit about some of the workforce shortages, particularly among culturally responsive providers. There was a lot of conversation around stigma that's shaped by some of the cultural norms that can either delay or prevent early help seeking. We talked about fragmented service pathways, as well as some of those chronic social and economic stress that exists that really just kind of further intensifies some of the mental health needs of our residents. So last month, we used these root causes to determine where our action plan should begin. And so we polled the group, and the majority of us, which was actually only 38%, voted to focus our efforts specifically on workforce capacity and support, in the realm of just like strengthening the availability and diversity of the behavioral health workforce providers. Now, I do want to note that our votes were very, very close. We had stigma reduction and system navigation and coordination that followed closely behind, both at 23% of the group vote, which I think tells us something important, right? That a lot of these issues can be interconnected, and we talked a bit about that as well. And during our discussion last month, we also acknowledged that, we know that there are many ways that we can address this problem statement, but rather than trying to tackle everything at once, we wanted to commit to identifying a strong starting point, something again that felt urgent, something that felt feasible, but also aligned with our current efforts. So I think you all kind of may remember me talking a little bit about quality over quantity, right? And so we recognize that even though our starting point is workforce capacity, our broader goal, specifically our strategies, might naturally incorporate some of the other elements that are here. So we might have some strategies that touch on stigma, and we might have some strategies that touch a little bit on coordination. Remember, the idea is that we begin broadly, right? So we started way out here, and then we're slowly narrowing our focus towards a more actionable and really a more equity-centered CHIP strategy, and to kind of determine what we think success could look like over the next 3 years for us, right? So that brings us to where we are today. We have our problem statement, we explored the root causes of that problem, we identified a starting point, and so now it's time to streamline a bit further to set an overall goal for our approach. And to do that, we're going to use what's called divergent thinking. So for anyone unfamiliar, simply put, divergent thinking is a structured way to generate many ideas quickly, right? So it's about exploring some possibilities, even some unexpected ones, before narrowing down into one specific thing. So in other words, we're opening the lens first and then narrowing later. So again, starting broad and reeling things back in. So to start this divergent thinking, let's start with something simple. I present to you a fork. So looking at this fork, I want you all as a group to consider, what are all the possible uses for this fork? And you can unmute, you can type in the chat, but what are some of the different things we can use with a fork? Let me open my chat so I can make sure I see everybody. Yep. Dr. Ojami says eat. I think most of us eat with a fork. Any other thoughts? Cook. Okay. Decorate a cake. I've never done that. Okay. I like that. What are other possible uses for this fork? Pry open something. Denise, you're right with me. Break ice. Press down on pie crust. Simple household repairs. Yes, I've screwed a few things with a fork and a knife before, so guilty as charged. Are we all familiar with the movie The Little Mermaid? And in the movie, she twirled her hair with a fork. I am also guilty as charged for that. Carlos says to poke. Denise, weapon, self-defense. I should probably keep a fork in my purse. So yes, thank you for that feedback. Denise says to stir. Tap on glass to get someone's attention. Awesome. Yeah, a lot of times that happens at a wedding, right? We're doing a toast. Jewelry. I have a bracelet made from a sterling silver fork. Wow, that's awesome. I gotta see that. You have to show me that, Shatia. That's pretty cool. Use as, okay. For plants, we're digging with our forks. Yes, I love this. Yeah, so notice what's happening, right? We moved beyond the intended or obvious use of the fork. The very first answer was to eat, right? And now we're starting to think a little bit more creatively. So some ideas were practical, some were silly, and some were surprisingly useful. I now know that I need to carry a fork in my purse at all times of self-defense. If I want somebody's attention, I can tap on a glass, right? I can use it for my plants. So these are all really, really great ideas. This is divergent thinking, right? So we're trying to generate many possibilities before narrowing in, and this helps us to see options we might otherwise miss. So I want to apply this same kind of thinking to our goal, but with a little bit of a twist. So I need everyone to use your imagination here. And I want you all to imagine that we are in a room. Of course, we're in a virtual room, but if we were in a real room, imagine there's a bowl of pasta in the middle of the room, and everyone here has a fork, right? Some of us may hold or use the fork differently, right? Some of us might eat like this, some of us eat like this. Some may want to twirl the pasta, some may cut the pasta with the fork. Some people may scoop it all up, and some people may not want to use the fork at all. But if everyone acts independently, we might all try to use our fork with the same goal in mind, and that's to eat the pasta. So, in other words, that's like duplication. But if we all took a moment and just paused and kind of coordinated together, instead of all of us trying to bum rush this bowl of pasta, what if one of us gathered more ingredients? What if another person prepared or seasoned the food? What if another person brought an additional serving bowl? Maybe someone else helps to set the table. Maybe another person can help us portion the pasta for everybody's plate, right? In this instance, everyone is contributing in some way. And now our meal has flavor, which I like flavored food. Seasoned food is definitely a win for me. But also, the table now has space for everyone, and there's enough and more food to go around. The meal works because this effort is more coordinated, right? And so even if everyone contributes differently, we're all still working toward the shared outcome. And our coalition work is very similar, right? We all hold forks. Some of us have programs, some of us do outreach, some of us provide services to the community. Maybe some of those services are free or low cost. Some of us offer expertise, lived experience. But if we operate in isolation, we're all competing for the same pasta or the same goal. But if we coordinate, we can create a full meal and feed more people, right? Our coordination is what makes our collective impact stronger. So I kind of want to use this framework to get us to our goal setting. Now, typically what happens when people draft goals, they often jump right into solutions or programs, and that's like thinking of eating the pasta with the fork. But divergent thinking lets us take a step back and we can ask or consider, what could success look like? Who benefits? How are people benefiting? Maybe we're considering what's missing if we only stick to something that's familiar. Or maybe we can take a moment to sit back and consider some additional bold or even creative possibilities, right? But by thinking broadly first, we're giving ourselves more options to design a goal that's more ambitious, that might be a bit more inclusive, and a little more innovative. So before solutions, we need clarity on a destination. Where are we trying to go? And so that brings us to our core question. With the problem statement and the starting point in mind, I want you all to kind of start to brainstorm what success looks like 3 years from now. And I'm going to actually share my whiteboard and we're going to do some brainstorming together. And hopefully we can visualize some of this for you. Are you all seeing the whiteboard with the problem statement and some post-it notes? Yes? Okay, I see some nods. Awesome. Thank you. So again, our problem statement, rates of depression, anxiety, and substance use are rising among county residents, especially youth and young adults. And our starting point, we decided as a group to focus on workforce capacity and support. So strengthening the availability and the diversity of the behavioral health workforce. And so I know we have some community practice in the room. I think I saw a few private practitioners in the room. And so I want us to think creatively as community partners, as practitioners, as community organizations, if we were to address this problem statement with our starting point, what would success look like 3 years from now? And feel free to use the chat. You can unmute yourselves to speak, and I'll kind of start to type in what our thoughts are so we can see if there's any common themes here. Same day access. Okay. Love it. Thank you, Margaret. Any other thoughts? If we were successful 3 years from now, what would be different? What changes would you like to see? Okay, access to affordable vocational programs to strengthen trade skills. Okay. Forgive my shorthand. Strengthen trade skills. Awesome. Less burnout for employees. Okay. Less burnout for employees. Thank you, Dr. Blount. Decrease in self-harm. Okay. Oh, typo. Okay, contribute. Yes. Any other thoughts? Let's see. Expansion of coverage. Okay. Love it. Spell. Expansion of. Whoops. Focus on wellness for clinicians. And kind of put that up here. Focus on wellness for clinicians. Okay. Greater use of quality behavioral services because of the increase in practitioners. Love that. Put that here. Greater use of. Other thoughts? Decrease in therapist-client ratio. Okay. Here. See some other thoughts. Targeted recruitment and hiring. Okay. Love that. Better coordination of care. Workforce policies that support employee mental health and SUD treatment without stigma or fear of impacting employment. Preventative programs, lower case risk in youth and young adults, no cost quality services, overall improvement in healthy behaviors for self-maintenance, increased relationships and collaboration between community health and private practice, violent crime prevention programs. Love this, love this, love this. More incentives for health. I'm sorry, lost my spot. More incentives for health providers, career counseling for youth to include expungement. Yes, that would be great. These are all great ideas. See if I can get some of these down here. Targeted recruitment, hiring, better coordination of care. Love that. Okay, workforce policies. Love that. More preventative program. Okay. I think we have a few others. Career counseling for youth. Oh, said that warm handoff between levels of care, increase in support groups. Love it. These are all great ideas. Are we seeing any common themes? Investment in continuing education. Care coordination. Increase in support groups. Improving quality of life. Strategic coordination plan to reduce silos between healthcare providers. Yeah. I'll make sure I get all these themes down. Some of these other thoughts, but I see common themes of care coordination, collaboration. Any other common themes between the group? Feel free to unmute if you'd like as well. think some workforce, common themes around workforce support for clinicians, for providers, employees. Any other common themes?
Yeah, I'd say employee well-being,
Love that. Was that Dr. Blount?
of course.
Of course. Hi, Dr. Blount. I love it.
Hi.
Thank you.
Mhm.
Awesome. Yeah, these are all great ideas, and I'll make sure before this that I'll send this out to everyone. I'll make sure everybody's input is considered as well. But these are all great, great. Working smarter, not harder. Common theme. Yes. That's my motto. Thank you, Carlos. Appreciate that feedback. Yeah, so we're seeing some common themes here: care coordination, collaboration, workforce support, and employee well-being. Working smarter, not harder. All of these are really great, great themes. So thank you for that feedback, and feel free to continue adding to the chat if you'd like. Not a problem. So what I'd like to do, so now that we have some of these common themes, and if you want, you can scroll through the chat a little bit because I wasn't able to get everything from the chat onto the post-it notes here, but I will. I want us to now use these themes, these common themes, to start drafting our goal. And what we'll do, right? So again, this is all about drafting. We don't need perfect language right now. I will clean it up a little bit after the meeting, but let's use this goal setting formula as a guide, right? So if you look at the top of the screen on the green side, our formula is we want to either increase, improve, or reduce what for who by how much or in what way. And then we have a set time frame. Now we have 3 years to work on this plan, so we'll work on our time frame a little bit later. So there's no rush on identifying that specifically, but we can focus on some of these other pieces first. And as we draft, I want to make sure that we're also keeping equity in mind, right? So we want to remain equity centered as much as possible, and that our goal reflects some of these common themes. So our coordination, collaboration, our employee support and well-being, working smart, not hard, right? Again, we don't want to duplicate too many efforts. We want to work collaboratively and coordinated and in a coordinated effort. So I did provide a couple examples just to kind of get our brains started. And this first example focuses specifically on improving culturally competent care. So one goal could be, if we were to focus on that, is to improve access to culturally responsive behavioral health services, specifically for Medicaid insured or uninsured residents by expanding partnerships with 5 community-based organizations by 2028, right? Just an example. Another one specific to early help seeking, for example. We want to increase the percentage of youth and young adults who report seeking help for mental health concerns at first signs of distress by 15% by 2028. Okay, these are just examples, but I want us to kind of use that to help get our brains thinking, right? So again, we want to increase, improve, reduce what, looking at some of these common themes, for who and by how much or in what way. So again, you can use the chat. I'd love for you to unmute. We can work it out. We can talk it through. Again, it's not about perfect language, but we just kind of want to get some thoughts going here. So anyone want to kick it off and get us started?
I'll kick us off. And again, this is just to start thinking about it. But I think, how do we increase like behavioral health wellness in all aspects of the community, so that, you know, everyone in the community could either do, and I don't know all the programs, but even the lay person can do mental health first aid to reduce the stigmatism of behavioral health issues, and everybody can do something. And then past, you know, as they become certified as, you know, mental health first aid individuals, they can then navigate in people to the higher level of care if they need it. So something along that line.
Okay.
But I think when you engage the whole community at different levels that they're appropriate for, it helps reduce the stigmatism and it creates a culture of wellness around behavioral health.
Love that. Thank you, Margaret. Any other thoughts? Again, not looking for perfect language, but just some ideas to get us started.
So this is Shatia. I'm gonna add to improve employee mental health.
Mm-hmm.
Um, that's all I got. Em- For who? So it's employees, by how
Mm-hmm.
much and in what way. I think so improve employee mental health by um ensuring a match between the healthcare benefits offered and the need of the workforce.
Healthcare benefits offered and the need of the workforce.
Yeah, understanding that there may be mismatch or there may be no benefits offered at all. You know what I mean? Um, so that's an idea.
Okay. Thank you. Awesome. Any other thoughts or feedback? I see Jamie. I hope I said your
Yes.
name right. I'm sorry. Oh, awesome. Hi, Jamie. Welcome.
Hey, no, that was perfect, so thank you. I wonder if it would look like um increasing mental health access for the Prince George's County community by increasing efforts to culturally responsive mental health services and also different language um will support to okay, so this is off script, but like
Okay.
basically improve the ability of clinicians and caregivers to be adaptive depending on like different languages and cultures.
Okay. Okay. Okay, I'm tracking. Nina, I see your hand as well.
Thank you.
Yes, I'm
Thank you
going
for
to
that feedback, Jamie.
I'll echo Jamie and Margaret. I think this falls in line with what they're saying. We've talked about this before. Increasing access to clients or consumers regarding what providers offer what services and what the entry points are into those services, and how to access those providers. It's fairly ambiguous, I think, at times to lump all of behavioral health care together. So who's doing what? Where are they? How do I find all of that information out? And then what's my starting point once I've selected someone?
Okay. Love that. Thank you for that feedback. Was there another hand, Dr. Blount? I think I saw you.
Yeah, but there's one before me.
Oh, I'm sorry. I can't
Oh,
see
it's okay.
who was
No, no, no.
first.
She just put it down. She put it down.
Okay.
So mine would be to reduce the I don't know if silos is the right word, but the separation, well, maybe improve or increase collaboration between public and private mental health. We all have a different vantage point on community and the different, folks in our community. And I think that there's a ripe opportunity to collaborate and partner and work together.
Love that. Great feedback. Thank you.
Mhm.
Any other thoughts? Sorry if I missed somebody with a raised hand. It's hard to catch you all when the
Hi, Shanae, it's
notification comes up.
Denise.
Oh, hi, Denise.
Hey, so, and I'm just gonna kind of spit it out. Hopefully we can
Sure.
reframe it. But it has more to do with the data and tracking so that we can obtain the data needed and coordinate around that for our support services. So with that being said, coordinating, I'm back up and say identifying key um, coordination performance metrics that we could all possibly utilize when we apply for specific funding opportunities so that we can take that information and put into perhaps like a more centralized data operation or database. And then we could essentially be a little more consistent about the data that we're capturing and how we can use that data or to identify perhaps gaps in service and delivery and or coordination. That makes sense.
Got it down. Thank you. Again, I'll clean this all up and I'll. There's someone else in the chat. It says to increase the number of applicants in the behavioral health workforce by 10% by 2028. Jalen, I know you put that in the chat, but do you mind expanding a little bit if you're able to?
Yeah, I was just thinking more so about if part of the issue is that there's a lack of like cultural competence in the behavioral healthcare workforce, like increasing the number of applicants might help address that issue.
So thank you. Any other thoughts? This is all great feedback.
I have one. I don't know if I said this already, but like healthy workplaces, like maybe develop a standard for like healthy workplaces. I know sometimes certain like community health experiences, you know, from the workforce perspective, there's a lot of stories that aren't desirable. So maybe we could come up with something to reach toward in that regard, like uniform, you know, especially thinking about the previous person that said, you know, increase the applicants. I think there are, you know, a lot of applicants often, but maybe sometimes people may not stay for various reasons.
Love that. Great. I see Carlos co-signed workforce development is definitely important. Thanks. And I saw some hearts going up. So I think people appreciate your thought process here. So thank you for that, Dr. Blount. So it looks like we have some other common themes kind of in our goal setting too. So this is great.
I do have one that I wanted to share.
Sure.
We're talking about wonderful resources, but also like a centralized place where residents can have easy access to those resources. You know, right now we have resources, but they're not interconnected, and there's not a centralized place where we can go and find the different resources available.
Okay, great. Thank you for that feedback. Any others? This is all good, all great feedback. Hearing none, that's okay. I'll give another 30 seconds just in case anybody else is typing or wants to give any last minute thoughts. And what I'll do is I'll clean these goals up a bit. I might follow up with a couple of you just to make sure I'm capturing your thought accurately. And then I'll present the goals to you all at next month's meeting. We'll vote and then we'll start working on some strategies for that goal. Any last minute thoughts?
I think I just have one, Shanae, and
Sure.
I want to say a centralized coordinating care platform, like with different authority levels, but sort of like to know if there's SDOHs that somebody doesn't have to repeat it 5 times with 5 different providers.
Sure.
Like a coordinated care platform so that providers community health workers, peer support, they can go in and say, oh, Margaret, I see you've been referred to a food pantry, so your food insecurities have been taken care of. How's that going? So they know they don't need to duplicate that effort. So a centralized care coordination platform, I guess would maybe be the easiest way to say that.
Yep, love it. Speaking of, that reminds me of Find Help. And I know that there's some conversation around utilizing Find. Do most of you use that? I'm just curious. This is more for me, my curiosity. But is that something that people are using, whether that's at the health department or other private practices or community health workers that might be on the call? I see some hearts. And with a platform like Find Help, for those who are using that, well, one, if you're using something else, I'd love to know what that is. If you want to drop that in the chat, that would be great. But for those who are using Find Help, is your experience generally positive as the provider or care coordinator? How are your clients feeling about it? What is some initial feedback, I guess, as it pertains to whether it's Find Help or another platform that you all might be using?
One thing I would like to maybe say, and this has been years in the works, but again, similar to what I'm saying here, even like with there's Find Help, there's 211, there's these different platforms, and I think if we could wave a magic wand, have the state like choose one or figure out, because trying to keep up two and figure out who's using what, where, and when, I think is really hard. So, because there's some things in 211, there's some things in Find Help. And again, like back to Denise, is like, where is that one platform that everybody could sort of upkeep, and which one should it be? I don't know.
Yeah. Okay. No, that's great feedback. Denise also wrote generally positive, and I've received good feedback from community members that have used it. There just needs to be additional coordination of care to complement it in most cases. Awesome. Programs at Bridge Center use Find Help regularly. We found it useful. Okay, great. Yeah, I'm most familiar with Find Help. We utilized it a lot at the previous health department that I worked with. It had some kinks and things we had to work through, but and definitely a learning curve for some organizations. But I'm always curious as to what the general feedback is, because I've heard some people are using it, some aren't. But the idea of having a more centralized platform for coordinated care is something that I'm hearing across all work groups and across county lines. So I'm always just interested to like, if this is what we're all asking for, how can we really build on this? So I appreciate that little segue there. Thank you all. All right. If there's any last minute thoughts or comments on goals, and again, what I'll do, one, thank you all for leaning into this process with me today. And next month, what we'll do is we'll take things one step further. Again, I'll take these drafted goals and I'll put them in a more defined format, and then I'll share them with you all. We can talk a little bit more about them, vote on one or two, and then we'll begin the fun part, which is actually operationalizing what we drafted today. So again, thank you all for your presence and your partnership, and it's going to be essential moving forward. So I'd appreciate it if you all hung with me for a couple more months, but we're going to get through it. Carmen, Directory of Resources. Okay, perfect. Thank you. Thank you. All right. Well, with that, told you I'm gonna try to get you all out here a little early today, but there are quite a few community announcements, so please bear with me as I go through these with you all. But there's so many great ways to stay connected. There's so many resources available, so many ways that we can support each other's work. And as always, I will be sure to share these out after our meeting today so you can have them for reference. You'll have the links and the flyers and all of that good stuff. But let's get started with our first community announcement. We are pleased to announce that the upcoming fiscal year 26 area plan listening sessions are happening. And the goal with these listening sessions is really just to make sure that we're gathering meaningful input from our residents, from service providers, from advocates and community partners like you to ensure that the area plan reflects the real needs, priorities, and lived experiences of those who live and work in the county. Specifically for our older population, for people with disabilities, for our caregivers, and those historically underserved communities as well. So there will be 2 sessions. You can join either in person or virtually, and the dates, times, and locations are listed on the slide. On Friday, February 27th, the Open My Heart Foundation will host its 4th annual Heart Health Equity Symposium. So this will take place from 1 to 3 p.m. at University of Maryland Cap Region Health in Largo. This is a free event that will focus on heart health equity and closing gaps through some of the new laws that are out, and it is open to the community. Please note that seating is limited, and I will make sure that the registration link goes out with the follow-up email. The Greatest of All Time Expo team on Saturday, May 2nd at Bowie State University. They are hosting their Youth Mental Health Expo. There's going to be a full day of workshops, resources, support for youth and their family, some live performances. It's a free event to attend. I don't know if anyone has been there before, but I heard great things about it, so you can register using the link on the slide. Chesapeake Life Center just released dates for their 2026 Camp Navy on August 7th through the 9th. This is a full weekend overnight camp in Millersville for youth ages 6 to 18 years old who have experienced the death of a loved one. So it's a great opportunity for them to feel supported, to get resources, education on how to handle and deal with grief. And so if you are interested in getting some more information, you can reach out to our fellow coalition member, Carrie Stansel, for more information. I don't know if she's on the call. Carrie, are you with us today? Okay. Well, I'll make sure. Please feel free to reach out to her if you have any questions or need some more information. We're also excited to partner in promoting the upcoming free prostate cancer health fair. This will be on Saturday, February 21st, so it's coming up. 10 to 2 at the Largo Kettering Perrywood Community Center. This event, they're going to provide free PSA screenings, resources, support, education. They'll have some speakers there. So please feel free to invite the community. Many of us know that prostate cancer continues to disproportionately impact men in our region. So it's important that they get that early screening. Early detection saves lives. So your support in spreading the word and even attending this event would truly make a difference. And some familiar announcements. Hope Connections and the University of Maryland Cap Region, they're hosting their virtual all cancer support group. It's every Wednesday, 12 to 1, so you can register to attend. There's great information, resources, support through your journey. So if you or anyone you know is interested, please feel free to join this support group. Prince George's County Parks and Recs has their winter activities guide available for you. I am hoping winter is almost over because this cold weather, I'm over it. But if you are interested in looking through the PDF version of their guide, that's hyperlinked on the slide for you, and you can visit their website for more information as well. Dine, Learn, and Move. We have a bunch of our community partners who are hosting this 90 minutes of free virtual fun. February's class focuses on heart health, and it will take place on Wednesday, February 26th from 6 to 7:30. Please note that registration is required, so you can email the email address on the slide to do so. Please save the date and join MedStar Southern Maryland Hospital Center and Clinton Baptist Clinton Baptist Church for a day filled with educational resources and support at their Health and Resource Fair Saturday, March 14th at 10 a.m. Also, they are looking for vendors. So if you are interested in signing your organization up to share information, programs, resources, please feel free to use the hyperlink on this slide to sign up as a vendor. The University of Cap Region is also hosting their chronic disease self-management program classes. This program is meant to empower people who are living with chronic diseases. We're going to provide them with tools, resources, education, all the things that are needed to help them manage their health more effectively. It is a 2.5-hour class that meets each week over the course of 7 weeks. So it's a cohort, and that starts Tuesday, March 24th. So you are welcome to visit their website for more information and to register. I think this is our last announcement. Medicare Diabetes Prevention Program. This is a free program to help reduce your risk for type 2 diabetes. So if you or someone you know is at risk, you can call or text the number on the slide. They're offering a virtual information session every Monday for 30 minutes via Zoom. The link to join is provided on the slide. Are there any additional announcements at this time?
I have one.
Sure.
I Am Me, starting March 10th, we're having a 10-week grief group for professional Black men dealing with the loss of a loved one. Is a virtual group. It's $80 a group. You could get, we accept, we are out of network provider, but could, work with your insurance if you have private insurance. And so also I wanted to know, Shanae, can I send you the flyer to include in the announcements for next
Yep,
time as well?
you read my mind. I was just getting ready to say whatever information you have, feel free to send it my way.
And is there a way to put it in a chat or no?
Yeah, you should be able to
Upload a flyer.
upload it into the chat. And if not, again, well, please still send it to me so I can send it as a
Okay.
follow-up as well.
Will do. Thank you. I'm gonna try to figure this out now.
Sure. There should be like a little plus plus icon, and you can upload like a document through there. Also, I see Carmen commented the DSS located in Landover has a food pantry for anyone who needs it on any given day. So thank you, Carmen, for sharing that. Told you we had a lot of announcements. Any others from our work group members?
Good afternoon. Can you hear me?
Yes.
Hello. Good afternoon, everybody. I'm Anya Makarova with Prince George's County Council, sitting as the Board of Health. I did want to bring two items to the group's attention. The first one, I'm really happy and excited because we have our House Delegate Martinez, who has introduced a bill which seeks to bring adolescent psychiatric beds into Prince George's County. This has been a Board of Health priority for a number of years. So we're definitely excited for this legislation, and we're looking for our community partners to come out and testify. And that'll be on March 4th and 10th when the hearing for these legislations will be taking place. And obviously there are opportunities to submit written testimony as well. So this is the first announcement. And of course, like currently, Prince George's County, we're the second largest in the whole state, and we have 0 children or adolescent psychiatric beds. So this is a huge, huge deal. And then the second announcement is that on Tuesday, February 24th at 10:30 in the morning, Prince George's County Council will host a briefing on Alzheimer's and dementia, and that'll be led by Alzheimer's Association. And based on the recent report released by this organization, as they surveyed more than 3,000 counties in the nation, Prince George's County came as number 4 for Alzheimer's prevalence for our adults 65 and over. So once again, just FYI, and of course that briefing will be live streamed on County Council's website, and it'll be also recorded if anybody wants to watch. Thank you so very much for your attention to these two items. Thank you.
Thank you, Anya. I appreciate that. That's awesome. And you said the first hearing regarding the adolescent psychiatric beds, that's on March 4th at 10?
No, so that'll be on March 4th and March 10th.
Oh,
So I'm still
and
trying
March
to figure out how the states work at this point. But for further details, perhaps I can share that information so that you can distribute it to the group to see if anybody actually wants to come and testify, or as I said, submit written comments. That'll be
Awesome.
wonderful.
Thank you so much.
Absolutely. Thank you.
Any other announcements from our work group? Well, hearing none, if anything comes to mind that you'd like me to send out to the group as a follow-up to this meeting, please just send it to me. You can send flyers or just written text. If you can send it before noon tomorrow, I would appreciate that, just so I can stay on schedule with when I send my emails out. If anything comes after that, I'm happy to share as well. And any events that you have, we can add to the calendar on our PGC Health Zone website as well. If you have not done so already, please scan this QR code. You'll be able to click the link after the meeting as well to update your contact info for the coalition directory. I've seen some of you have already done that, so thank you so much. But again, some of our partners have transitioned to other priorities, so they're no longer with the coalition, and we have many new partners with us now as well. So I want to make sure that we're maintaining just an accurate record of who's with us, who's participating, and we'll also make sure we'll also be using this directory as a way to ensure credit is given to those who are participating in our chip development process. So please, please, please make sure you complete this coalition directory survey, and I would greatly appreciate that. I am not too shy to beg, so please fill out this survey. Okay. And I will end with our quick snapshot of upcoming work group meetings for the remaining quarter. I know all of the work groups are on here, but that's just because many of us have asked about some of the other work group meetings, how they can be a part, when do they meet. So I wanted to make sure everyone had all the dates and times for the rest of the work group meetings, and it's just for this quarter. But our next Healthy Minds work group meeting will be Wednesday, March 18th, same time, same place. I also want to note that we have our quarterly coalition meeting coming up already next month on March 10th. So it's Tuesday, March 10th at 6 p.m. and it will be virtual. The link to register is on the slide, but I will make sure you all have access to that after this meeting as well. So we encourage you all to please register early so we know who will be in the room. There are some transitions happening, updates from some of the other work groups, so more to come, but we appreciate everyone's participation. And of course, as we close, I just cannot thank you all enough, as always, for your insight and your partnership. I really appreciate you all being here today, and I look forward to continuing this work with you all. Thank you so much, and I pray you all have a wonderful afternoon. So thank you all.
Bye.
Bye.
Thank you, Shanae. Thanks
Of
all.
course. Thank you. Thank you, Jamie. Bye, Denise. Bye, Lisa. Thanks, everyone.